discussing about supervision and monitoring. So what supervision and monitoring is all about? To begin with, though people interchangeably we use the word supervision and monitoring, but both are different in their meaning, context, and the intended benefits out of that. So to begin with, to simplify it, if we look into supervision, there has to be two class of set of people. One is supervising and another is supervisor. So not necessarily all the time supervision has to be done with the people only, but largely when we talk in public health programs, we talk about uh, human bringing qualitative parameters, enhancing the qualitative parameters of healthcare staff. So a supervision process and activity has to bring in the qualitative intended qualitative parameters into the program so that the quantitative numbers are also matching with the qualitative output of the program. So to cut it short, there a supervisor is one who has certain expectations which is not met during the project program cycle. So supervisor assesses the need, and based on that need a supervision program is developed, and the purpose is that through this program the quality is brought and stewardship is brought within the supervisory, so that both quantitative and qualitative parameters are met. When we talk about monitoring, it is an ongoing process and it is largely quantitative in number, and they are assessed against the milestone indicators that could be designed as midterm, interim, or it could be into like input indicator, process indicator, output indicator, outcome indicator, and impact indicator. So to begin with, we will see what is the actual objective of both supervision and monitoring. Sometimes monitoring comes as a subset of supervision, and so together we will see what is the intended benefit that we want to reap out of this supervision and monitoring. So if you are looking at this dartboard, the purpose of dartboard is that all the darts should be hit at the center of the dartboard, but somehow due to some imperfection or lack of error in precision, other darts are not meeting. Only one dart is hitting the center of the dartboard. So purpose of this whole exercise of supervision and monitoring is to do the right thing in right manner to meet the program goals and objective. So what we try to do after out of this objective of supervision is to ensure implementation of program, to build capacity of the health staff, to increase the involvement, to provide timely and actionable feedback, to assess HR and training need, to ensure logistic management, to ensure accurate and valid data recording in lecture. So to begin with, what I have tried to do is to uh, capture the barriers which are actually not permitting a person supervisee to the task that he's supposed to do. So I have broadly categorized those into four kind of barriers. One is opportunity barrier, another is ability barrier, third is skill barrier, and fourth is motivation barrier. So before doing a supervisory in a quality enhancement program, it is necessary to have assessment whether there is an opportunity barrier. What opportunity barrier means? Suppose a person is overloaded, overburdened. STS is overburdened. He is placed at Sadar Hospital, and the kind of footfall during the OPD hours is such that he does not get adequate time to provide counseling support to the TB patients. So, because so what he actually do, he does away with the dispensation of the drugs, and the patient goes away, and he does not do the counseling because each counseling session will require at least 15 to 20 minutes for one patient. And so because of opportunity barrier, he since he is overloaded, he is not able to do his job. So we have to do workload assessment, we have to do optimization of load, and similarly for ability is that requisite qualification and certification that a person needs, capacity building exercise that a person needs to do intended job. For a counseling session to be conducted, STS must be having a necessary requisite training and capacity building for conducting a counseling session. If he does not have that kind of technical knowledge to perform that job, so we need to do design a capacity building program. Third is a skill. Skill is different from ability because it tells about the manner in which a particular job has to do. Suppose all the STS are trained on counseling, but there will be a certain number of STS who have perfection in their job, but others may not be able to do. So we have to also do what kind of skill a person is applying during his course of job. So if some hands holding support is required, accordingly hands holding support will be provided to him or her. Fourth and the most important is motivational barrier. If a person is not motivated to do his job, we have to bring in what kind of motivational support he requires, whether it is an incentive, whether it is a job hike, promotion, or it is a reward and recognition. That is accordingly as a supervision program should be framed so that it brings a stewardship and ownership in the program. Thank you.